It's estimated that 1 in 7 adults in the U.S. have chronic kidney disease, and the CDC says as many as 9 in 10 don't even know that they have it. And women with chronic kidney disease who plan to have a family also face unique challenges and risks. So we have Dr. Sydney Corpier here of Dallas Nephrology Associates to give us a little bit of insight. Good morning to you.
Good morning.
Glad to have you here. So tell us, what is chronic kidney disease and how is it categorized as well?
Chronic kidney disease, or CKD, just means that there is a damage to your kidneys or a change in your kidney function, and it can be from any reason. And the chronic part of it means that that's gone on for at least 3 months or more.
Wow, wow. Okay, so then how does chronic kidney disease, impact pregnancy? Because we were just talking about how as many as 9 out of 10 don't even know that they have it. So how can that affect maybe even your future that you're trying to build?
Yeah, it's interesting that it's thought that about 6% of women of childbearing age actually have chronic kidney disease.
Wow.
And that about 3% of pregnancies are affected, or women who have chronic kidney disease. So yes, these women, the thing I want women to know is that if they have it for any reason, whether it's lupus or a transplant or whatever, that they are high-risk pregnancies, and they are subject to higher risk of complications like preeclampsia, about 10 times the risk. They have they have a higher risk of preterm labor, and they have a higher risk of small size babies, and they have about a 3 times risk for needing a C-section.
My goodness.
So they are definitely at risk.
Heavily affected, for
yes.
Sure. My gosh. Okay, and it's just wild that you say this and note all of these different things because of the simple fact that there's plenty of people that don't know they have it. So how do we go about that next step? How do we figure out if we do have it?
Well, to figure out if you do have it, we see 2 separate things, right? We see women who have already been diagnosed with chronic kidney disease that want to have a baby, and then there are women who, in the course of becoming pregnant, somebody finds out, oh, they have high blood pressure, or their kidney function's not normal, or there's protein in their urine. And so when women are aware of that, they need to have a nephrologist involved in their care.
Yes, indeed. You just mentioned high blood pressure, which affects plenty of people. Tell me the effects of it on pregnancy.
So high blood pressure can happen anytime during a pregnancy. So you have a segment of people, women who have already had high blood pressure going into their pregnancy, and you have other women who develop it during their pregnancy. And so the women who've had it beforehand, they need to have their medications adjusted in advance, their blood pressure controlled, and medications, by that I mean pregnancy-safe medications, and have good control of their blood pressure. Women who develop it, on the other hand, they need to be assessed to see if their kidneys are involved, and they need to be treated and managed so we can have a healthy mom, healthy baby.
Yes, indeed. No, tell me, how can someone with chronic kidney disease prepare for a pregnancy? Let's say we're looking to the future. How do we prepare for those things so that we can get through it as best way as possible?
Yes, and this is actually a really fun part of practice, to be honest. It's a little scary, but it's a very fun part of our practice. And they need to have a thorough discussion with a nephrologist. All these women, ideally, before they're pregnant, need to see a high-risk OB, and then have their medications adjusted, like I said, to be pregnancy safe. They need to look at starting on aspirin to prevent preeclampsia by 12 weeks, exercise, and we're aiming for a term delivery.
Yes, indeed. What I'm hearing from you this morning, it sounds like we really just need to focus on intentionality, right? And so making sure that if we are planning for the future and we want to build our family, that we do take the precautionary measures to go visit the doctor and ask if we have anything going on before we take the deep dive. Thank you so much, doctor, for being here this morning. I think this is a really important conversation because there are tons of people out there who like we said, don't even know that they are affected by it. So Dallas Nephrology Associates has been treating kidney patients for more than 50 years, you guys, and it has more than 110 healthcare providers in 38 area locations. So there's got to be one near you. All you have to do is call 214-358-2300 or 877-654-3639. And for more information or anything else, any questions that you have, you can go to dneph, that's neph.com. You can also scan that QR code that's on your screen right there.